Okay, perfect. Morning, everybody. My name is Oli Trading, and today we're going to be talking about fetal alcohol spectrum disorders, or FASDs, FAS, or FADs, whatever you want to call them. So let's get into it. The etiology. FASDs are caused by women drinking alcohol during pregnancy. Obviously, we know that alcohol isn't good for us as adults. So we can imagine how much more harmful it would be towards children. And just like how a mother eats her salads and her fruits and her chicken, and that passes through to the baby to give it nutrients, that's what happens with alcohol. It actually goes through the blood, through the umbilical cord to the baby. So all of the stuff, the toxins in alcohol, they actually go to the baby while in the womb. So this has a very negative effect on the baby. And because of that, there's a lot of things that can happen. It could alter the brain of the baby and several other things. We're going to look at some of those things. So signs and symptoms that someone might have an FASD, they might have lower than average body weight, poor coordination, poor muscle tone, hyperactive behavior, difficulty with attention. They might have poor memory, difficulty in school, and this could be physical difficulties, obviously academic difficulties as well. We have other learning disabilities, speech and language delays, intellectual disability or low IQ, poor reasoning and judgment skills, sleep and sucking problems as a baby, vision or hearing problems, problems with organs such as the heart, the kidneys, even the bones, shorter than average height, small head size. The alcohol can really affect the brain growth of the baby. So a lot of times their brain will only grow half the size of what it should normally, causing their head itself to not grow as big as what it should be. And then finally, there's other abnormal features. If you guys take your finger and you feel between your nose and your upper lip, you'll feel a ridge there. That's called your philtrum. A lot of these cases don't have philtrums. It's just flat, smooth skin between the nose and the lip. So these are a bunch of different signs and symptoms of FASDs. These are also the effects of FASDs to child. Prognosis. So I had a little hard time kind of finding this one because this is a very interesting thing to have prognosis for, because it affects everybody so different. I mean, how much was your mom drinking and to what extent did it affect you? But there was a study done by the Journal of Population Therapeutics and Clinical Pharmacology where they said the average life expectancy at birth is about 34 years old. And that's pretty young. 34 is really young in terms of how long we are meant to live. And I thought it was very interesting as it continues. It says the leading causes of death for people with FAS were external causes. So suicide, accidents, poisoning by illegal drugs or alcohol, other things, nervous and respiratory system problems, digestive system, congenital malformations, mental and behavioral disorders. All of these different things, even though there's a wide variety and they spanned over different things, these are all effects that alcohol could have on our babies. So this is just a message to anyone out there who's planning on being a mom. If you do participate in drinking, I highly advise you not to while you're pregnant for the sake of your child. Some medical interventions. So there's no specific medication that's been approved to treat this, but there are things that can help, such as stimulants, antidepressants, neuroleptics, and anti-anxiety drugs. Once again, they haven't been officially approved, but these are things that can help with FASDs. And there's also programs in schools to help these kids with social skills. And because since their brains usually haven't matured all the way, or they've had problems, they usually have behavioral problems. So they have a lot of programs in school to help these kids. Finally, what's our role? How can we help these kids? Physical therapy intervention. The infants or young children will have problems with their fine motor skills. So some things that we can help them with is they have trouble reaching objects, grasping them, lack of curiosity, they avoid tummy time, they struggle to lift their head, or if they're unable to sit without support by 8 months. These are all things that physical therapy can help these kids with. And they have different exercises and things that they will do. Finally, just before I end, I watched a TED Talk about this lady who's fostered in the span of 12 years, 100 different kids, most of them struggling with fetal alcohol spectrum disorder. And she actually just talks about how rough it could be and how important it is to make sure we take care of ourselves and that way we can take care of our children. But yeah, that's all I have to share today. Thank you guys for your time.